Oksana Pyzik is a lecturer at UCL School of Pharmacy and a global health advisor. She joins us now from London. Oksana, welcome to the program. We've got before the end of this calendar year, Hanukkah, Kwanzaa, Diwali, Christmas, Thanksgiving in the early days of January, Christian Orthodox. It celebrates its new year. What do you think the next 6 or 7 weeks are going to look like in terms of people when they traditionally get together and what restrictions might be in place?
There has been a massive drive to try and upfront some of these restrictions so that there is a little bit more flexibility towards the end of the year in certain countries. We've heard many governments caution that we should not expect a return to normal just for a holiday season and that it's going to look very different for all of us. We may be growing tired of this virus, but it is not growing tired of us. And it continues to prey on the people who have the weakest healthcare systems with the greatest inequalities. And so we expect to see a big division here in terms of health outcomes in themselves. I think one thing that unites the world is that 9 months into this pandemic, most countries are reaching a point of fatigue, of communication fatigue, of the warnings that are coming from the government that are just failing to be very as effective as they were back in March at the beginning of the pandemic. That sense of urgency, despite the fact that cases are accelerating globally, just isn't there. And the ultimate message really is that we need to control the virus, or the virus will control us.
Sweden has already indicated, its chief epidemiologist has told Swedes, be prepared for a Christmas that won't be normal. The Irish government on Thursday saying to Irish nationals abroad, don't book your tickets home for Christmas just yet. France has also said. But do you think that fatigue that you're talking about, might it make people disregard the rules because some of these holidays are so particular and people are so used to celebrating in a way that brings big groups together?
I do think that's a realistic risk, and I think it would be at this stage irresponsible to think that just putting out messaging will be enough to curb or encourage behavior change. And I do think this is also linked to a wider mental health crisis in which we see many people now are reaching a particular point now that at least if we look at the Northern Hemisphere is getting colder and darker, and this is having a profound effect on the ability for people to sustain this type of prolonged isolation periods. So I do think that there's going to be the governments are going to have to find ways in which individual needs can still be accommodated for, but while there's minimal risk in transmission and particularly large gatherings discouraged. But this idea of bubbles, which has been very popular throughout the UK in terms of encouraging as people, particularly who live by themselves or students, to be able to find some source of comfort and relief. We must not underestimate the importance of this. And I do think this is going to also come to a political compromise, especially around, as you say, some of these holidays have such importance amongst different communities, and they are all really very close together at a time where the world has now surpassed 1.25 million deaths in countries like US and India. We also see that there's uncontrolled spread, meaning that the worst is still ahead.
How worried are you that people will start behaving differently now that there are a few vaccines out there which claim to be at least 90% effective? Pfizer hasn't started manufacturing its vaccine, but the Russian Sputnik 5 won 92 to 93% effective and being manufactured, indeed already being administered in Russia itself. And then there are multiple other ones that are in phase 3 trials. The more people hear this potentially good news, are they likely to change their behavior, thinking if I get it, okay, there's something out there that might help me, although obviously a vaccine isn't about curing COVID-19, it's about not getting COVID-19.
You put it perfectly. The vaccine will take time also to distribute, and so it will not really impact this second and in some countries even third wave of coronavirus. So in that sense, we know that there's limited manufacturing capabilities, and we've heard from multiple governments that all of this good news should be tempered with cautious optimism. And that's important because we're not over the final line yet. There's still some further safety checks to go. And then beyond that, Pfizer has said that within the year, they can only really produce about 1.3 billion doses, which again will not meet the requirement of an entire global population. We do hope that other vaccines like AstraZeneca and the Oxford one may also then soon be rolled out. But as you say, all of this is in the future, and it helps in the sense that of preventing infection, but it will not save someone's life if they already develop extremely severe symptoms and end up in the ICU on a ventilator. So for now, we need to live in the present, live as though we have the virus. That way we are cautious about every interaction that we have. We keep socially distant when we need to get our essential supplies. Here in London, we have another lockdown expected to go on to December 2nd until we can get that R value lower. It's currently between 1.2 to 1.4. So this will maybe not even be long enough. And so that unless people change their behavior, the virus will continue to spread and it will prolong the pandemic. So I am concerned that all of this celebration about, yes, this is a big scientific feat. We've made significant, innovative progress, unbelievable progress when we look at the timeline. And it just shows what's possible when all of the companies and scientists have the urgency to focus on a singular problem. But it will not save anyone in the current weeks to come, where we expect another surge alongside, as you mentioned, these holidays. So the key message here that the WHO, many heads of state have also said, is that we can see the end in sight, but for now, we need to protect ourselves. We need to protect our vulnerable and continue with the public health guidance. And that remains a significant challenge as we head into some of these celebratory seasons. But it is one that we have ultimate responsibility for. And I do think that the messaging from governments has to be precise. They cannot get this wrong, given what is at stake now.
Oksana Pyzik, really interesting to hear your analysis. Thank you so much indeed for joining us on the News Hour.